Hi, today we're going to be learning about how to put DMSO on Adonis's jowl. He's got a little bit of swelling on both sides of his jowl from a fly mask that created some uneven pressure points there. So we're just working on reducing that swelling, and we can do that by using this dimethyl sulfoxide ointment. This is great because it helps to reduce swelling that is not necessarily related to injury to that area. So we're going to use that to kind of break down the swelling that has built up there over a few days' time. We're going to need the DMSO. The DMSO has a red sticker on top, which means that you must wear a glove when you apply it. We're going to need a glove, so you can get one of these medical gloves right below the treatment supplies in the feed room. So we'll need the glove, we'll need the DMSO, and then we've also got a damp towel. This towel is going to be used to wipe the area clean before we apply new DMSO. It's important that when you're applying DMSO, you're always wiping the area clean from where old DMSO was applied, or if you haven't used it before, you just want to make sure that the skin and hair is clean and dry before you apply it, because we don't want any bacteria or dirt or debris on the surface to be absorbed into the skin. So it's very important that you're applying it to clean hair, not dirty hair. So we've got the towel for that. So we do not need to wear gloves to wipe the horse's jowl clean, but we will need to put the gloves on when we open up the DMSO and put that on our fingers. So I'm just going to set this down and then use the towel first. I'm going to wipe the areas directly where the DMSO was applied on his jowl previously, like this. And then I'm going to do the same thing on the opposite side because we've got to do it on both sides. Once that's done, I'm going to go ahead and put my glove on. I only need one glove. I don't need two gloves. Only the hand that is coming in contact with the DMSO needs to have a glove attached to it. As long as you're not sticking your fingers that are just holding the container into the container and coming in contact with any ointment. I'm going to unscrew the lid like this, and I'm just going to set this aside. I'm not going to try to hold this while I'm doing this. And then just like with some other medications that are a little bit more loose or runny, especially in the summer when it's warm, I just need a tiny bit, okay? A little bit goes a long way. So I'm just gonna stick my finger in there, or I could even stick two fingers in there is fine. And then I'm just going to apply the DMSO directly over top of the bump in the direction of the hair. I don't need to rub it in. I don't need to go back and forth. I'm just gonna do a light application directly over top of the bump. I'm gonna do the exact same thing on the other side. Because the hair and skin are clean, your fingers should not get dirty when you do this, which means that the DMSO is going to stay pretty clean inside of the jar. I can kind of show you that. It should always be clean. It should always be nice and clear. As soon as you're done, you're going to go ahead and put the lid back on, and then we can remove the glove. That's all we need to do. So as soon as we've removed our glove, like that, and thrown this away in the garbage, then we're going to put our horse away and we'll put our supplies away. Your dirty towel is always going to go right in the laundry, and then you're done.